Okay, so we're going to go ahead and get started today. So I'm just going to kind of outline a little bit about today and how we're going to run things. So we'll spend about 30 minutes on talking. We have different presenters who will talk about different parts, different areas of impact around COVID-19 and what's happening in and around campus. And the next 30 minutes will be a question and answer session. So a few things to know is that if you have a question that you'd like to pose to any of the panelists, our preference is that you write your question in the chat feature. And that way we can record the questions whether they're available to us afterwards, and then we can go back. And if we didn't answer all the questions, we can put those questions into our frequently asked questions on our website. The other option is that you can submit a question anonymously through the Q&A at the bottom of the screen. That allows you to submit questions anonymously. We'll be checking those, but again, if you have a broader question that is applicable to a lot of people, you can put it in the chat. We may also not answer questions that is really specific to one individual. So the other thing that I'll let you know, just wanted to share real quick too, is that, here, I'm gonna share my screen real quick. And, oh, I clicked it off of it. So you probably all went through our website in order to get here today. And just remembering that this is the frequently asked questions here. And we update that almost every day. And so even though you may have read it, you can keep checking back to the frequently asked questions and find the latest information there. Okay, couple other things to tell you real quick. Let's see. This is going to be recorded, as I said, and it will be posted on our webpage for a few days. Just please remember that information is changing rather quickly, so any information we have in here can be dated very quickly. And again, going to the FAQ questions for the most up-to-date information. Okay, so I think I've covered everything in order to get us started for today. So I'll go ahead and hand us over today, starting with our Assistant Dean and Director, Barbara Kapler of International Student and Scholar Services. Barbara, can you unmute yourself?
Yes, I can. One of the most frequent requests over the last several days. Welcome, everyone. I am really glad that you've taken time to join and to connect with all of us. We will do our best to provide clear information and look forward to hearing what your questions are so we can best figure out how to serve you. As we begin this session, I wanted to make a few points of introduction. One is explaining what ISSS has been doing over the past several days. We saw early on the need to look to move our operations remotely and have spent significant effort to try to make that transition be as smooth as possible so that we can continue to provide advising services. And at this point, we believe we have quite a clear transition in that we have information available on how you can contact ISSS and that we are still providing full services while working remotely. We've also been working with campus partners to look at what might be the unique challenges for international students and scholars, and looking to how we can both provide information as well as looking to reduce the disruptions as much as we can. We have fantastic campus partners. The administrators have been working really well together, of course, but also just really diligently to focus in on the most pressing questions and concerns of the day. And our campus partners are across the university. We've been working consistently with housing, university partners in undergraduate education and the graduate school. And we are working together to provide updates either through them directly or through our site with the frequently asked questions. On a more personal note, I think these times are unprecedented for each of us, and that we know we aren't you. We know we aren't a student right now in your particular situation. We do, though, at ISSS have significant connections around the world, and most of our staff have family and friends located throughout the world. And we do definitely empathize with the stress of the situation in just even the simple task of collecting information and being in touch with family and friends. And we are definitely an advocate for you in this really, really challenging time. I certainly am not in a situation to be dispensing advice to what people should be doing for their own personal health or how we make adjustments to this situation. I, like you, am figuring it out. At the same time, I think it's really important that each of us consider how we have made successful transitions in the past. Everyone has been successful using a variety of different strategies. I'll just share briefly, for a short period in my life, I was doing sprint triathlons. And one of the more difficult components of the triathlon is when you switch from one sport to another. So from swimming to biking or biking to running. And for me, the swim to bike was always very challenging. And one of the aspects of making that transition be successful is keeping moving, get that momentum going, but then you maintain that momentum by actually taking rests. That there is no all out nonstop. There is a system of kind of getting yourself into that cadence. And so that's something I share with you just as an example of something that I'm personally drawing upon, and encourage you to be thinking about the places where you have been successful and what you can draw upon as well. Of course, things are changing. This is a really common theme. Just this afternoon, there was notice of need to have shelter in place, which is put in place by the governor of Minnesota. So the leader from Minnesota makes that determination. Shelter in place means stay at home. There are a number of specific recommendations about this new shelter in place. It goes into effect in Minnesota at midnight on Friday through April 10th. We will definitely be providing more information, as it is clear you can be outside of your home, your unit, your apartment for grocery shopping as well as medicines. So we want to make sure people understand what this new procedure will involve, and we'll look to present that information to you as quickly as we can. So with those introductions in mind, I would like to turn it over to Grace Machoki, who is our lead advisor with ISSS.
Thank you, Barbara. And it's really great to have you online today to make this connection during this challenging time. And I'm going to take a few minutes to just bring up some questions that have come up around how to maintain your F1 or J1 immigration status while you're taking classes online or even completing them from home. At this point, as you might know from our messaging in the past, the university and ISSS really supports you in making that decision to be home, to be with your family during this time, and you can take classes online from there. And those classes are going to count in maintaining your full-time status as long as you do not drop your classes below the required credits. we've had questions from students asking, what if the university canceled a class during the transition and now I'm below the required full-time classes? We want you to know that the immigration regulations require you to maintain your full-time status even during this semester. And we would like for you to connect with us so that we can help you with filing for a reduced course load request. Another question that has come up quite a bit is about students who are graduating this semester and they are planning to apply for post-completion OPT, or for J1 students who are trying or planning to apply for academic training. The regulations again require for you to be here in the United States to be able to submit your application. So as you decide on whether to go home and also thinking about applying for those work permits, we would like for you to consider that as well. A couple students have also been asking about the 5-month restriction, asking if I leave the country during the remainder of this semester and I return back more than 5 months from when I left, is my visa or my I-20 going to be canceled? The answer to that is, if you're maintaining your full-time or registration status this semester, taking classes abroad, you will be maintaining your status and your CVs will not be canceled. CVs record can only be canceled due to other reasons that we would be able to be talking to you about even before that happens. So make sure that if you're home, you don't worry about the 5-month rule as long as you're taking your classes and completing them as needed. Another thing to mention with taking classes online from home is we just want to make you aware that you could have some issues maybe with accessing those classes or even signing into the system through VPN. Please make sure you're connecting with your academic advisors and your professors if you have those problems so that they can help you make sure that you are completing your classes successfully. Another situation that has come up recently is about visa application or renewal at the US embassies. Many of the embassies have currently closed the visa extension process, and we are not sure when that is going to be open. And we anticipate there will be a backlog and appointments will be most probably difficult to get in a timely manner. So we want to encourage you to be watching and looking at the embassy and the consulate websites for any updates about opening of those appointments. And also just reach out to us if you're experiencing any of these challenges so that we can also help with helping you figure out more information about it as well. I think those are the items I wanted to point out today. I'm now going to hand over the mic to Dave. Oh, I'm sorry, to Nasri Mohammad, the Director for Student Engagement.
Thank you, Grace. Again, my name is Nasri Mohammad, and I'm the Director for Student Engagement, and I will be talking to you about bias incidents and how to get support. So first of all, I want to start by saying to you that ISSS is here for you. And as part of being at the university, I want to affirm the university's commitment to being an inclusive and welcoming campus. As I begin to talk about bias, and just a little explanation, bias are acts that are intentional or unintentional that are meant to hurt people based on someone's identity or group identity. So quick example, someone uses a racial slur when talking with you or near you. Someone tells you to go back to your country. Someone refuses you entry to an establishment or service due to your appearance. So these are just a few examples. We know that incidents of bias are on the rise and impacting international students, especially Chinese and other Asian students, as well as Asian Americans. Now, these incidents are really a result of racist, and xenophobic responses to the coronavirus pandemic. The reports we have been getting at our office are reports of mainly people making hurtful comments. However, we want to make sure that you are taking precautions and getting support. It is often, when a bias incident happens, it is normal to feel confused and fearful, and also question yourself whether it was your fault about what happened. So I just want to kind of explain to you just a couple of things. It is so important to tell someone if a bias incident has occurred. You have support from us, specifically to reach out. And if you choose to report, please let ISSS know. And there is a reporting mechanism on campus called the Bias Response and Referral Network. Reporting to the Bias Response and Referral Network really helps us track what incidents are happening to students. Talk to friends and family. When people don't share, they tend to get more fearful. So we don't want you to feel fearful. ISSS has come up with an amazing tip sheet that we have come up with ideas of what you can do to either support someone who has experienced bias, or you, when you have experienced bias, how to handle it. Familiarize yourself with that sheet, and please talk to us if you are scared in any way. Again, just wanna say again to you, you are not alone. During this time, make sure you're taking good care of yourself, talking to folks, and reaching out to us. Again, looking forward to connecting with you, and so glad to see so many of you online. I'm gonna hand over to Dave Goldman and his Boynton staff to talk about how they have been supporting students.
Better unmute. Thanks, Nasri. So a couple of questions that have been coming up is, first of all, and a lot of you are probably familiar with what are symptoms for COVID-19. So just a couple of things about that is, if you have a fever and a cough and difficulty breathing, those are the classic symptoms. And to tell you the truth, we're not testing the general population at this point. So we still want people to call if you have questions about having COVID-19 and what you should do, but we're only testing healthcare workers who are sick right now due to a shortage of testing kits, the ability to test. So as soon as we get more kits that we can test, we will expand the testing. So for right now, if you have any questions, you can call our nurse line at 612-625-7900. It's on our website, but you can call and you can ask those guys questions like, should I be seen? What should I do? If breathing becomes very difficult, please call, or if we're closed, you can call an emergency room, and that you should probably get seen at an emergency room, okay? And that's difficulty breathing. It was really hard to breathe. Then it's becoming quite serious. Most cases are not that serious, the vast majority, but sometimes that happens. So right now, Boynton we're still open, and we're still seeing patients. It's not just for COVID-19, although we are doing a lot of appointments now online. And so either via the phone or via the computer, and we're also seeing people in person. But we're still seeing people that are sick with other conditions or injuries. When we're open, we're still open. The only thing that we ask is you call us first. just call one of the appointment lines, like the general appointment line or the nurse line, any of those, and we'll make sure that we're ready for you when you come, or we can tell you you can stay there and we'll call you for an appointment. We'll do something online. And that's for a lot of visits. The only thing we're really not doing are a lot of the things that can wait for a while, like our general, like health checkups, physicals, things like that. But for the most part, we're seeing about, kind of everything else really, other than the stuff that can wait. Mental health is fully operational. All the providers are on duty. They are seeing patients via Zoom right now, so they're doing it virtually. So you can call to set up an appointment if you need mental health care, and they'll be all set for you. Is the thing. It's just a little different. It'll be via Zoom. The other thing that we're doing is there's services for people that are having like eye problems, like emergency eye stuff. You can come into Boynton, call first, but they can see you for eye problems. We're just not doing regular exams or things like that. Dental clinic, they're closed for services, but again, you can still call them if you're having problems. We will be doing emergency dental care starting next week, probably on April 1st or sooner. But you can call the dental clinic and they're taking calls and answering questions about dental care and things like that. Some of the things we're not doing that you might be used to is Gopher Chauffeur is not running right now. Pause had to be suspended right now, but coming soon will be a virtual pause, and we'll have animals and stuff that will be literally on a page virtually, and we'll send out a schedule about that. It looks really cute. I'm very excited about the pause thing coming out as well. The other thing that we're running 5 days a week is the food pantry. So the Nutritious You Food Pantry. So if you need free food, we've got the food pantry is open. It's over at Kaufman. Our hours are on our webpage. Just type in Nutritious You, and that will come up. And you can visit and you can get a bag of groceries. And they'll do a new system starting next week, but that'll be published too, where you just have an appointment where you just come in and get your bag. And so you can order in advance and you can get a bag for a friend if you're bringing it to them. And for people that are sick, we'll figure out something too for delivery. So it sounds like, so that's all to come. As you can see, this is all changing very quickly, and a lot of the stuff we're doing is changing very quickly to see students. We're still doing visits for nutrition and physical therapy, again, online. We also are doing stress check-ins with De-Stress, just like we were before too. So if you want to talk to somebody just about stress management, that too is being done online. And so you can schedule those visits you can schedule online. The other appointments you can't schedule online right now. We need to do that over the phone. And so also, like I say, you can call with general questions too. Oh, we also have urgent or crisis counseling available too, and that's something you can call ahead, and we have counselors actually in the building to see people as well for urgent and crisis when we're open. So we're trying to keep as many things as we can to keep open, but we still want to make sure that we're protecting people to be safe. So when you come into the building, chances are you'll be asked to wear a mask, or you'll be screened when you first come into the entryway, just to figure out, where we should move you to, what kind of room, and then we'll be going from there. Oh, I forgot, pharmacy is open and up and running. It's all curbside. So you can check our website, and they're bringing prescriptions outside the building to people, but that's for new prescriptions, or let's say you just want to buy a regular medication that we have in the pharmacy. Yes, you can do all that online, or you can actually come in and order it too. So, and they're delivering right out to the street out front of Boynton. So we're doing everything we can there to try and keep everybody safe at the same time, but a lot of things are still available. So, how did I do? Did I get it in 5 minutes? Is that okay?
You were amazing, Dave. You're amazing.
Thank you.
So we have one more presenter or a panelist who's going to talk, and then we're going to open up to the question and answer session. And so, of course, if anybody, again, if you have any questions around Boynton or health, please put that in the chat, and we will bring that back to Dave and his team. And we'll go ahead and turn it over to Charles.
Hi, everyone. My name is Charles Danny. I'm an advisor at ISSS, and I'm also a member of the crisis team. I would like to begin by acknowledging that many of us have been impacted by the uncertain nature of all that's going on. And I want you to know that you're not alone in this. And as a community, we will get through this. I would like to talk about some of the kinds of challenges that international students are experiencing right now. Some coping strategies if you're going through difficult times, and some resources where you could get support. And so some of the key issues we're hearing from international students are stress. A lot of students are going through stress as a result of all that's going on. They're worried about family and friends, especially students who are from countries where we're seeing a very drastic increase in the number of cases. They're worried about their family members. We've also seen challenges with loneliness and isolation. There's been emphasis on social distancing, and not many people are used to that. And so it's an adjustment for a lot of people. Some ways that you can cope with this, and this is not an exhaustive list. It's something, you know, I would just recommend that whatever works for you, if you think that you've been able to come up with something that works for you, just keep on doing that. But these are other options that you can try. So the first one is checking in with family and friends. It's very important to check in with them at this time, especially if you're really worried about your family, and also if your family is really worried about you. So that's a very good way to keep that connection. You could do that through text. You could also do that through video chats, and so that would be very helpful. Taking breaks from social media and the news. There's been so many negative information coming from the news. Sometimes it's very depressing, and so it's okay to take a break from all of that and just, you know, be in your own space and think about other things. Getting exercise, that's another very good way of, you know, trying to cope during this time. I've had friends who have started doing virtual classes like yoga. That's another very good way to cope during this time. Listening to music is another very good one. And watching movies and reading books and articles is also very helpful. There is something called the Netflix party, so you could actually watch movies with friends and classmates. You just have to download it, and it's very good. For resources, ISSS is still providing counseling and support remotely. Please see our website for details about how to reach a counselor. And the student counseling services in Boynton Mental Health, just like Dave talked about, they are still providing services. Just go to their website for more information. The University Crisis Line is also available 24 hours a day, so please call. If you are in an emergency situation, feel free to call 911. And I'll turn it over to Beth for the Q&A.
Okay, thank you. A huge thank you to all the panelists. And so you provided a lot of great information, but we do have quite a few questions from students. So I think I'll go ahead and have Teresa, if you would unmute your microphone and ask Grace one or two of the questions.
Okay. So, Grace, one of the questions is whether or not students can apply for OPT at this time, and whether they should be using paper forms or the e-form.
So as of now, OPT applications are going on as we've done in the past. And for students who are applying for the post-completion OPT, asking for the recommendation I-20 from ISSS, they would still need to go through the My ISSS portal to submit that. And ISSS staff are working remotely, so our services are still open. We're able to issue I-20s and mail them to you. In terms of applying for paper, submitting paper applications, those are for the STEM OPT extension, and we are still accepting those through our ISSS email. So you can send your STEM OPT I-20 request as an attachment through our ISSS at umn.edu email account.
I'm going to ask you one more question, Grace, about OPT. There's a couple of them, but I'll give you one more right now, and then maybe we'll switch to some non-immigration questions. Because it might take longer for companies to hire students on OPT, will students be able to accrue more than 90 days of unemployment? Will there be any extension granted because of these unusual times?
As of now, we haven't received any guidance around changing the 90 days unemployment period. But from what we are hearing from other schools and the National Association for International Educators, NAFSA, we have people who are advocating to USCIS to see if some of these changes can be made. But at this point, we don't have any update. And in case that comes in, we'll be able to update you with that as well.
Great, I'm going to go ahead and ask another question. Nasri, this question is for you. It's about the question is, how do we deal with bias and racism related to the COVID-19 outbreak? We know, I know we can report to the EOAA, but there are a lot of times I think they, meaning students, do not want to reveal their identity. So we can't know if they're affiliated with the university or not. Can you just talk about a little bit about the process and how to support? Your microphone.
I've been so much better about unmuting, but so in terms of bias incidents, if bias incidents are happening on campus, Equal Employment and Affirmative Action Office can help. They will handle the bias. If it's a student-related peer-to-peer bias, our Community Standards Office, it also gets involved. And if it's a faculty or staff-related bias, they will handle it. Bias Response and Referral Network, their goal is to increase the level of support. So say, for example, an international student reports a bias, what the next step would be that they would be referred to ISSS. However, reporting really helps us track the number of incidents happening on campus. Now, if, for example, a bias incident happens off campus, there is very little EOAA can do and BRN can do. So one thing to know, if it's a incident where your physical safety is at threat, call the police right away. We want to make sure, please let ISSS know so that we can give you as much support as possible. In terms of being refused a service to an establishment, I'm not kind of quite sure about that, but I would support contacting EOAA or ISSS, and we can kind of figure out what action steps to take, because that would mean other government agencies would need to be involved. Hopefully that answered your question.
Okay, so I'm going to take us back to an immigration question here about CPT. Do you expect any delays in processing CPT, and do students need to continue to submit their applications through the My ISSS?
The answer to that is yes, you can continue submitting your CPT applications to ISSS through your My ISSS portal. In terms of delays, that is a really good question. From our office, we are still doing it within 7 days from the day that you submit the application for the I-20. However, since professors and academic advisors are also having to adjust how they are working from home, the the process of getting the document signed and approved by your professor or the academic advisor, that might take a little bit long. But again, it really depends on the processes. So as of now, for ISSS, we are still taking in those and approving them within 7 business days.
And I have 2 questions here. One's about regular OPT and one's about STEM. Do you anticipate delays in issuance of EADs for OPT and for STEM? And how might this affect the OPT start date and the 90 days of unemployment?
That's also another very good question. And I think it's a challenging one to answer right now, because with all the changes that we have and students choosing to go home, it's possible that maybe the number of OPT applications will be less than they've been in the past. But also we know a lot of offices are moving to work remotely. So if USCIS is also doing that, due to the transition, there could be a delay with that. So at this point, what I can say is if you're planning to apply for OPT and also you're choosing your start date, you can check in with us, with one of our ISSS advisors. We can talk with you through it to see what we can help in determining that date. However, we don't really know so far if there will be any changes to the unemployment period, if USCIS is going to be extending, giving a little bit of, an extended deadline for the application. So I would just urge for you to do the best you can, applying on time, talking to us, and we'll keep you updated.
Beth, do you want to take the questions?
Yeah, I'm going to give Dave a bunch of questions. Dave, can you go ahead and unmute?
I'm here.
Okay, Dave, there's a few questions here. So I have a great question of, I'm healthy right now, but I want to be prepared for a worst case scenario. I'm confused about what kind of help we can get seek if we have symptoms. Like what kind of help can they seek if they have symptoms? Again, it seems that tests are hard to get right now. How do the people get tests?
Yeah.
And then how much will they pay for the test and the treatment with university insurance? So that's quite a few.
That's okay. That's an easy one. So testing doesn't matter for the treatment of COVID-19. So the provider or the doctor can look at symptoms and say, you know what, I think this is COVID-19 because of the fever, the cough, maybe some other exposure or some questions. And the reality is, whether they test positive or not, the treatment is the same. We don't have any medication that we can treat COVID-19 with. And so what we ask people to do is isolate themselves, drink plenty of fluids, get lots of rest. And if they have difficulty breathing, call us right away so that we can make sure that you get appropriate treatment in a hospital. So the only people that are being actually treated for COVID-19 are those with underlying health conditions. There's some things they can do for them, like diabetes or asthma or some things like that. But also then the people that are actually hospitalized that will get put on ventilators or things like that. For care at Boynton, it's just like normal. So full-time, students with 6 or more credits, the same drill that are paying fees. You have insurance. There's no out-of-pocket charges for any kind of COVID-19 testing that gets done here or any kind of visits that are being seen here for acute illness or injury, just like usual. So there's no special rules or charges that have been put in place. I also have Greg Thurston here with me from our student insurance office in case he wants to add anything to those comments. So testing doesn't matter for treatment.
And the only thing I would add is that testing, like if people can't get to Boynton, if they're not in the area and they need to go someplace else for testing, and the medical provider indicates that a test is warranted, then that test would have no charge. So that would be fully covered. As Dave said, in most cases, even if you tested positive, you would just go home and be isolated, so you wouldn't really expect there to be any additional charges. If there was a situation where additional care was needed because somebody was going into respiratory distress or whatever, then the normal plan benefits would apply in terms of co-pays, co-insurance, those types of things.
Do we hit them all, Beth?
Please chat in there what we might have missed. So Teresa, you want to go ahead and ask your question?
Sure. This question is about how to get a travel signature on an I-20 and what happens to our visa status F1 if the US closes the border and it becomes impossible for international students to come back for the next semester.
So on our website, on our homepage, we have a Google form that you can submit to request for a travel signature. And in that form, we are going to ask you for your address so that we can mail the I-20 to you. And we are able to do that even with us working remotely. In terms of the borders getting closed and having no ability to come or to re-enter the United States, I think it's a big question. And it's a question that we are all thinking about and trying to figure out. I believe this would be a university question on how students are going to be taking classes, maybe continuing to take those classes online during the fall semester. But again, as you know, things are just changing every other minute or every day. But the leadership is working hard to figure out how to support the students, to be able to continue their studies at the U of M if you're not able to resume studies back on campus physically.
There's also a question here about applying for a social security number and the fact that international students have to apply in person, but the Social Security Administration is closed now. Is there anything we can do on our side since we can't really put an application online?
Teresa, I'll just throw that back to you. Did we have that on our FAQ today?
It's not on our FAQs yet, but we do intend to put it on there.
Okay.
So what I can say is that if a student is offered a job, they can let the employer know that at this time the Social Security Administration is not open and international students have to apply in person, but that at least at the university, our reading is that students do not have to have a Social Security number in order to apply for an I-9. Company will eventually want a Social Security number for tax purposes, and the student will want to get a Social Security number for tax purposes. But there's a little bit of time if that company's HR processes will allow the student to start work without it. Secondly, if a student is applying for OPT, part of the OPT application allows students to request a Social Security number, and that might be another way to get the number for the students that are applying for OPT. Oh, let me just see here.
Should I go ahead, Teresa, and then you can? Okay, so just a quick question for Barbara Kapler. Barbara, there was someone was asking about if there's a possibility that admissions would be canceled if the situation worsens. Do you have any insights about that at this time?
Yeah, thanks very much for the question. I think right now the institutional focus has been just on the immediate challenges that students are facing and then looking out to the future as much as possible. It is not the case that any cancellations are planned. And so I think rest assured that things are, that the communication from the institution to you is to keep staying connected. We will get you information as fast as we can. And I am not aware of any discussion around a cancellation.
Thank you. Thank you. Go ahead, Teresa.
So there's a question about graduating in May. and recognizing that students on an F1 visa are given a 60-day grace period. And they're asking if the situation gets worse and they're not able to get back to their country within that time period, what should they do in this situation? Will USCIS provide the solution?
That's another very good question. And I think at this point, what I can say is, as the office, we will be looking into these questions and trying to see if there's any new updates around changing the regulations around F1 student status, staying in the US more than 60 days. At this point, we don't have that information yet, but we'll be sure to be looking into that and add them to FAQs for you.
There are also a couple of questions about whether or not we have any updates from USCIS that are relevant to F1 students.
I think the updates that we've received so far, we've included them in our the FAQs list so far.
Yeah, and just to expand on that a little bit, so the Student Exchange Visitor Program, which basically administers the SEVIS system, has provided some of the updates that we've been able to include on that frequently asked questions sheet, or site. But some of these questions regarding extensions for more than 90 days of unemployment while on OPT, those are questions that have to be answered by USCIS, and they have not provided any guidance for us yet. But there has been an attempt by the professional association that international educators belong to request information that does impact international students. But we just have not heard back yet.
Thank you, Teresa. So I have a question here for Nasreen. Nasreen, we have someone who, it says, I have experienced discrimination after the US president specifically mentioned Chinese virus. So I think that they think that they're perfectly okay to say that. Is there anything that they can do about it when someone is saying something that like that to them?
First of all, it has been really disheartening to hear the president's comments, especially for all of us on campus and our staff at International Student and Scholar Services. I know that President Trump has shifted a little bit. I've been watching his news conferences lately that he has not been mentioning connecting COVID-19 to calling it a Chinese virus. So that's a shift. However, that's what his pattern has been. What can you do about it? One thing I would say, it's so important for people to speak out. Whoever their friend circle is in classrooms, and connecting to other folks in student groups, to just, first of all, get support, but really have a sense of that something that you can do is really write about it, connect with other students. So not giving you a perfect answer, but I'm just encouraging that it is important for Chinese students and Asian students not to be silent during this time. And in terms of the responses, I think I would really ask you to look through our tip sheet that we've put together that may give you some ideas in terms of the context in which this is happening. And I'm so sorry that this is happening at this time, so.
There are a number of questions that have been submitted about immigration type questions. that we can't really answer right now. We can certainly look into them and try to get more information, but at this time, some of the questions that remain are really ones that we can't answer. But we'll do our best to try to get answers and provide information on the FAQs.
Great. Thanks, Teresa. So again, we have a few minutes left. So Dave, I'm going to turn it back over to you and Greg. There were two questions. One was about for people who cannot get tested, and can they be prescribed any medications to help them recover? Experience in China and other countries in the last few months show that early treatment, medical support when symptoms are mild, can significantly decrease the chance that the disease develop into a critical stage. So if you have any comments on that. And then there is also that question of what is insurance actually able to cover?
So I'll do the first one on symptoms and any kind of early medication. So right now, at least here in the US, we're not aware of any that have been effective. I know that malaria medication seems to be showing some promise for folks, but we're not prescribing that at this point in time widely across the US. So really there is no early intervention that we have for folks for medication. We know that the antiviral drugs like Tamiflu and stuff have not had an effect on COVID-19. So that isn't recommended here at this time. So rest, fluids, a lot of those things can really help. We know that our people that do get admitted to the hospital are doing quite well overall in general, that's been effective, but that's when symptoms get, quite bad. So I'll let Greg talk about the insurance benefits.
Sure, with the student health benefit plan, keep in mind any services that are able to be provided at Boynton, wouldn't have any kind of cost as long as people are paying the student service fee that would cover that. If you need services outside of Boynton, then it's an 80-20 copay situation, which basically means you pay 20% and the insurance plan will pay 80% until you've met your out-of-pocket your out-of-pocket maximum, which is a total of $6,250 for the year. So your cost would essentially be 20% of the covered charges up to a maximum of $6,250. I think the question that came in talked about that the total cost they had read could be somewhere between 10 and maybe 30,000. So if that was really the case, then theoretically your out-of-pocket expenses could be somewhere between $2,000 or $6,000.
Yeah. And then even if the cost were several $100,000, exactly, the out-of-pocket would be $6,250 as well that they would have to pay, even if the bill was quite large. That means that's the most they have to pay. The other thing they should know is that is better covered than the vast majority of Americans have. And so if that's any consolation, I know healthcare here in the US is very expensive, but it's a really good plan to be on, is the thing you should be aware of. So you should feel confident in the insurance coverage that you have, that you've got a good deal going.
Great. Thank you so much. So we're going to take a little time to wrap up. And I'll turn it back over to Barbara Kapler again to talk about, just to wrap it up and tell you what the future plans are with continuing to communicate with all of our students and scholars.
Thank you everyone again for your willingness to be here together and for the really important questions. I want to make note that for those of you who are asking about fall admits and the concerns about getting a visa in time, we encourage you to stay connected with us, and we will work to communicate updates as soon as we can. This is certainly a national conversation about how best to proceed, and it's really just a few days for the United States to be making these considerations as an institution. So we will certainly be working on that question and be back in touch. So stay connected with us. For our session today, I want to thank all of the panelists and especially our guests from Boynton who are willing to spend time with us. To Dave Golden and to Greg Thurston, thank you so much for your time. For this event to happen, thank you so much for ISSS staff, Beth Eisensee and Alex Kleberg for organizing, Sandra Boone for helping us to coordinate, and certainly Nasreen, Grace, Charles, Teresa, Beth for being panelists and assisting with the Q&A. For future communications, we will continue with our weekly update, absolutely sending out additional email communications should any situations warrant that. We will be updating the FAQ, as I mentioned, for the most recent announcement today from Governor Walz regarding shelter in place, notice to stay at home, effective Friday at midnight. I'm checking in my list to see if there are other comments to be making in regards to our webinar. It will be posted. This specific webinar will be posted. This has been a pilot for us, and we look to examining the success of this in terms of its helpfulness for international students. We will be considering adding additional webinars in the future, and we'll be in touch about that. I do, as we sign off, since we have an audience, we still have a few people on, I do want to give a shout out to our ISSS staff. I'm very proud of their efforts in working to continue to find ways to provide service, and all the efforts made to move and to work remotely. It's a fantastic team. And finally, to all of you online, thank you again for joining. We are thinking of you every day, and we wish you the best and stay in good health.